Certain antibiotics come as powders that cannot be injected directly, so you must first reconstitute them by adding the right amount of sterile water. Remove the caps from both vials and clean the rubber stoppers with an alcohol swab, then let them air dry completely. To draw up the sterile liquid, attach a blunt needle to the syringe and inject the same volume of air into the diluent vial as the amount of diluent you plan to draw up. You do this because these brand new vials are airtight, so it can be hard to draw up medication without using excessive finger strength to fight the negative pressure that forms in the vial. By injecting the air into the airspace of the vial and inverting the syringe, it will fill itself to the right level, without you needing to suffer finger blisters from forcefully pulling on the plunger. Inject the sterile liquid into the powder vial. You may feel some pressure pushback, which is completely normal. Allow any excess air to vent back into the syringe before withdrawing it. Do not shake the vial, as this can create dangerous bubbles. Mix the medication thoroughly by gently rolling the vial between your palms until the powder is fully dissolved.
Have you noticed that the needle that's used to draw up a medication is never the same needle that's used to inject it? There are several very good reasons for this. Firstly, going through the rubber stopper of the vial makes the needle more blunt, so using the same needle to go through the skin would make it more painful. Some medications are also very thick, so you would need a smaller gauge needle to get them out of the vial as quickly as possible. And yes, to make things more confusing, smaller gauge needles have a bigger diameter, so an 18 gauge needle can be used to draw up medications, while a 25 gauge needle can be used to inject them. And as you can imagine, when the needle is inserted into the vial, some of the medication coats the surface of the needle. If this needle is then used to inject into a muscle or vein, traces of the medication would end up going into subcutaneous tissues, potentially causing a lot of irritation. Some medications come in these glass ampules, and we need to break the ampule to get the medicine out. But first we need to open the syringe and filter needle and attach them in sterile fashion. The filter needle will prevent any tiny pieces of glass from entering the syringe. Now here's a demonstration of how not to break a glass ampule. To do it properly, first flick the tip to get all the medication down. Then hold it with the blue dot facing away from you and grasp the tip with a sterile swab. Snap the neck by bending the tip towards you. This way any glass particles will fly away from you and you're less likely to be injured. If the needle is too short to reach the fluid in the ampule, you can turn it upside down. And don't worry about spilling the medication, because even if you shake the ampule upside down, nothing will come out. Advance the tip of the needle into the ampule and draw up a little more than the required amount. There was some air in the needle that will have gone into your syringe, so flick the syringe until it collects at the top, then empty the syringe until you're left with the required dose.